Namaste, welcome back to my channel. Today let us discuss on infection control practices. So in the infection control practices, there are 6 components are very important. If we follow these 6 components, definitely we can reduce the infections in the hospital. So there are safe injection practices, safe infusion practices, infection control practices, and healthcare workers safety, biomedical waste management, and cleaning, disinfection and sterilization policy. If we follow these practices, definitely we can reduce the infections rate in the hospital. Hand hygiene. Hand hygiene makes important role in infection control practices. It is the one way of cutting a chain of infections, and also it is very cost effective. If we follow proper hand washing practices in a hospital, we can reduce again infection rates in the hospital. There are 5 movements of hand washing: before touching a patient, before doing any aseptic procedure, after contact with blood and body fluids, after contact patient surrounding, and after touching a patient. These are all 5 important movements we should follow in the hospital, and there are 6 steps of hand washing. So here you can see the chart. There are 6 steps given by the WHO guidelines. So palm to palm, back of the palm or dorsum of the hand, in between finger are interlacing of a finger, interlocking of a finger, thumb rotation, and fingertips backward and forward, vice versa. So these are all the 6 important steps of hand washing. And standard precautions, again this is also one category of infection control practices. If we follow proper standard precaution, again we can reduce the rate of infection in the hospital. Enough standard precaution, it is hand hygiene. Again it is very important, and using of personal protective equipments by wearing of gloves, gown, mask, eye protections. These are all very important personal protective equipments to again reduce the infections rate in the hospital. Definitely it will reduce cross infection to the healthcare workers. Another important practices in infection control is prevention of healthcare associated infections or nosocomial infections. Healthcare associated or nosocomial infections are acquired infections in the hospital. So these infections are acquired in the hospital by a patient, that is if was not present at the time of admission. So the infections was not present at the time of admissions, it was occurred after hospitalization. The common HAIs are CAUTI, CLABSI, VAP, SSI and Phlebitis. CAUTI are CAUT, catheter associated urinary tract infections. Very commonly we can see in a HAIs, and criteria are after insertion of an indwelling catheter, at least after 48 hours of insertion of a catheter, if patient shows any signs and symptoms like fever more than 38 degree and suprapubic tenderness or costovertebral angle pain or tenderness. And criteria 3 is a positive urine culture. In a urine, if there is any growth and colony count more than 1 lakh, we can consider it is a CAUTI. Next one is CLAPSI, CLABSI, central line associated bloodstream infections. The criteria are after 48 hours of central line insertion. Criteria 2, patient has at least one of the following signs and symptoms like fever more than 38 degree centigrade, chills or hypotension, and at least one of the following. Criteria 3, blood culture from 2 or more blood culture drawn on separate occasions and blood culture shown positive report. We can consider it is a CLAPSI or CLABSI. Next one is VAP, ventilator associated pneumonia. The criteria are after 48 hours of putting patient on ventilator. Criteria 2, patient has a chest radiographic examination that showed new or progressive infiltrate, consolidation, cavitation or pleural effusion and at least one of the following. Criteria 3. New onset of purulent sputum or changes in the character of sputum. Criteria 4. Organism cultured from sputum. Criteria 5. Isolation of an etiologic agent from the specimen. So this we can call it as BAP. Next one is SSI, surgical site infections. The criteria are: infections occur within 30 days after the operative procedure and involves only skin and subcutaneous tissue of the incision, and patient has at least one of the following. Criteria 2. Purulent drainage from the superficial incision. Criteria 3. Organism isolated from the aseptically obtained culture of fluid or tissue from the superficial incision. At least one of the following signs and symptoms of infection: pain or tenderness, localized swelling, redness or heat, and superficial incision is deliberately opened by surgeon unless incision is culture negative. Diagnosis of a superficial incision SSI by the surgeon or attending physician. Next one is phlebitis. In a phlebitis, we should measure VIP score, visual infusion phlebitis. This I have already explained in another video. Just go through with that video. So these are all the main hospital acquired infections. By following of care bundles, we can reduce the rate of infection in the hospital. So compulsory we should have a care bundle to prevent as hospital acquired infections. Next important practices are reduction of needle stick injury and blood and body fluid exposure. NSI or BBF. NSI and BBF usually occur in the following situations: during and after IV insertion, recapping of needle, sudden patient movement, especially children's, inappropriate disposal of biomedical bins, fail to dispose of used needle in the puncture resistant sharp container, transferring of body fluids from syringe to containers, lack of proper workstations for procedures using shops, work quickly. So these are all the main important reason to get needle stick injury or blood and body fluid exposure. Immediate management for NSI or splashes. Encourage for bleeding from the injury site. It should not be squeezed. Do not apply plaster. Do not suck from mouth. Skin wound should be washed with soap and water in a running water. Do not apply any antiseptic solution. Eyes should be irrigated with a liter of saline. As soon as needle stick injury and blood and body fluid splashes, immediately inform to infection control nurse and then go to emergency room and inform to casualty medical officer. So this is the first aid for needle stick injury or blood and body fluid exposure. After first aid, blood test will be performed after NSI and splashes like HIV, HBsAg and HCV for the staff and for the source. If source or patient is HIV or HBsAg positive, then follow up treatment regimen within 2 hours of injury. If it is a patient is positive for HIV, there are lamivudine and tenofovir efavirenz. This is a new regimen for the HIV post exposure drugs, and for a HBsAg immediately we should, if a staff is vaccinated, we should check the antibodies level. If the antibodies are normal, if it is more than 10 IMUL, need not to give any post exposure drugs. If it is antibodies are low and staff is not vaccinated and patient is positive for HBsAg, immediately the staff should take immunoglobulin injection as per the body weight, and also vaccination, hepatitis B vaccination will be started to the exposed person. And also regarding this needle stick injury management, I have made one video how to manage needle stick injury and blood and body fluids. Please go through with that video, you will come to know how to manage this NSI and BBF. Next, another remaining topic will be discussed in another video. Please continue to watch my videos and please give me a suggestion or feedback and support my channel. Thank you.